So I see we have over 100 participants, so I think that's a good mark to start off. A very warm welcome to the launch and discussion of the impulse paper Planetary Health, How Do We Want to Shape Our Future, of the German Advisory Council on Global Change, in short, WBGU. My name is Maike Voss, and I am one of the managing directors of the German Alliance on Climate Change and Health, and a new director of a soon-to-be established think tank on planetary health here in Berlin. Today, we want to talk about planetary health, and the aims that we want to achieve in the next 90 minutes are, firstly, discussing and ideally partly answering the questions raised in the impulse paper. Secondly, gaining more ideas and thoughts for the next WBGU report on planetary health, which is currently in progress. Concrete, we are looking for more policy recommendations for the new German government, and especially from you and from an international audience. And thirdly, of course, we want to support building a vibrant inter and transdisciplinary planetary health community of scientists, policymakers, and experts in the field of health, climate, and social sustainability. Maybe some words on the WBGU. The German federal government set up the German Advisory Council on Global Change as an independent scientific advisory body in 1992 in the run-up to the United Nations Conference on Environmental and Development, Rio. The task of the council is to analyze global environmental and developmental problems and to develop recommendations for action and research in the quest for solutions to these problems. The council has 9 members and works in a 4-year term. It is funded by the Ministry of Education and Research and the Ministry of Environment. Some small words from my side on the agenda and on housekeeping. We will first hear the presentation and of the discussion paper from Professor Dr. Zabina Gabrish, followed by 3 short comments from international experts on our panel, who I will introduce to you in just a second. Then we move to a panel discussion. You will see that I have the panelists with me, invited co-commentators in the Zoom meeting who can engage with the panel via raising their hands and turning on their camera and microphone. And we also have the wider audience who can use the Q&A function here in Zoom. And I will pick up then the questions. If you have any technical issues or question, please contact the control room here, the control room person here in the chat. And we will also put more information in the chat box. And please note, maybe you have seen it already, that this event will be recorded. Before we start, we have a little participation tool prepared. We have a small survey that will pop up in just a second, because we want to know from which sectors you come and get an idea who is with us here in this digital room. So yeah, there it comes. I see it. I hope you do too. Which community do you belong to? Maybe you can give us an idea. I will do this as well. So we will see the results of that. I will tell you the results of this in after the presentations. So I'm now very happy to welcome Dr. Zabina Gabrish, who is a member of the WBGU, a medical doctor, an epidemiologist, and a global health researcher. She holds a professorship for climate change and health at the Charité Berlin and leads the research department Climate Resilience at the Potsdam Institute for Climate Impact Research. Sabine will now present the content and questions raised by the impulse paper. Sabine, over to you.
Thank you, Maike. So now I'm on, and I hope you can see my screen.
We can, yes.
Excellent. Oh, wait a second. My cursor. Yes. Okay, so planetary health, how do we want to shape our future? That is the title of our discussion paper. And let's start with an overview of the state of global health, including good, bad, and ugly news. Here, the around 8 billion people globally, 1 billion very poor, 1 billion fairly rich, the rest somewhere in the middle. And the movement of billions of people along this development path over the last decades means that living conditions have improved substantially for many people around the world, and so has people's health and well-being. That is the good news. However, not all people have benefited from this development. Far too many, especially those living in poverty, are still dying from diseases that could be prevented or easily cured, such as diarrhea, pneumonia, malaria, or birth complications. Further bad news is that along with rising prosperity and modern lifestyles, new health problems emerged. Too much unhealthy food, too little exercise, and air pollution have caused a sharp rise in chronic non-communicable diseases, in obesity, diabetes, cancer, and cardiovascular disease worldwide, including in low and middle income countries where there is also still a high burden of poverty-related disease, leading to the so-called double burden of disease. And now the ugly news. The rise in human well-being and health along this development path has been at the expense of increasing human interventions in nature, of hugely increasing our ecological footprint on the planet, with our use of natural resources now exhausting the planet's buffer capacity. And with some delay, this is now backfiring via global environmental changes, climate change, biodiversity loss, pollution, threatening our livelihood and our health. Climate change is intensifying weather extremes with deadly heat waves and floods. The destruction of natural habitats makes pandemics more likely. And the planetary crisis threatens social cohesion and can overwhelm health systems. The poorest are the most vulnerable, but everybody is affected, as we now increasingly experience. Time is running out and we face a double challenge: environmental destruction and social inequality. We have to get into this corner here: good health for all at low ecological cost, as envisioned in the SDGs. This requires a great transformation of all societies worldwide at record speed. How can we achieve that? In fact, one can also imagine this coordinate system a bit like a mountain. The higher up, the healthier. So the SDGs are up here on this high plateau, and the environmental destruction paths end somewhere, as there's a limit of how much ecological damage we can survive. And humanity has been moving at high speed along this path towards the abyss, causing the whole mountain to slide. And as we continue, we enter increasingly slippery slopes and tipping points. So we need to quickly get on the path towards the SDGs, good health at low ecological cost, which means a turnaround for the rich. And the poorest need some support to climb up directly, to leapfrog the environmentally destructive development stage. The crisis is an enormous threat. According to the Lancet Commission, the biggest global health threat of our century. At the same time, the crisis could also be a great opportunity for global health. It gives us the opportunity to rethink our idea of prosperity and progress, to break habits and make our societies fairer, more sustainable, and healthier. Because many environmental and health problems have common roots, which means when we tackle them at their roots, there are many common solutions, win-win situations, synergies, multiple benefit strategies. 3 examples. Burning coal and oil heats up the planet and it pollutes the air, which causes a huge burden of disease and an estimated 3.6 million deaths per year. Shifting to solar and wind energy is good for the climate and for our health. Shifting our transport infrastructure in a way that makes our cities easy and comfortable to bike and walk not only reduces greenhouse gas emissions, but also fine particle pollution, traffic noise, accidents, and it increases physical activity, all of which would be great for our health. a transition to the so-called planetary health diet, with plenty of vegetables here in green and very little meat in red on our plates, would be a huge win for climate, biodiversity, animal, and human health, with an estimated reduction in premature mortality by around 20%, 11 million deaths per year. The WBGU is currently working on the interconnections between health and global environmental change and put forward 3 assertions and 10 sets of questions for discussion. Here are the assertions. Our lifestyle is making us ill and is destroying the planet. Healthy people can only exist on a healthy planet. We must initiate a civilizational transformation for planetary health. It is key to realize that as living beings, we humans are an inseparable part of nature. And despite all technical achievements, we are ultimately dependent on nature. Comprehensive health concepts such as One Health, Eco Health, and Planetary Health emphasize the degree to which the health of all organisms is interconnected and the importance of global ecosystems as a fundamental precondition for healthy living. After all, the air we breathe, the food we eat, the water we drink, and the biodiversity that surrounds us all determine our health. We don't just cut the branch that we sit on, we are actually part of the tree. We are part of that complex web of life or that card house that we are interfering with. Which leads to the question, how do we achieve a shift in mindsets and attitudes in order to reach a fundamentally different way of dealing with nature? And how might a healthy relationship with nature look like? What should we do? What should we stop doing so that planet Earth can heal? How can we combine climate protection, adaptation to climate change, and biodiversity conservation with health protection? How do we deal also with the limits to how far we can adapt to climate change, up to regions becoming uninhabitable? Our societies also need healing to reduce inequalities and strengthen social cohesion. How could this work? How can our societies be shaped in such a way that health promoting and sustainable living conditions become possible for everyone, including for vulnerable groups with poverty-related health risks, which are now further exacerbated by the environmental crisis? Now coming to the 5 selected domains for action. Our food systems. The way we produce food and feed ourselves destroys natural habitats and biodiversity, pollutes air, water, and soil, generates greenhouse gases, is cruel to animals, and also directly harms our own health. What framework conditions are needed and what barriers must be overcome in order to initiate a food systems transformation for sustainability and health? Health systems are also in disorder, often underfunded, understaffed, and increasingly profit-oriented. We have unmet medical needs in some areas, but also unnecessary medical interventions in others. Health promotion and prevention are terribly neglected. What does a health-promoting, environmentally friendly, and resilient healthcare system look like? And how can access to that be provided to all people worldwide? Urban areas have a huge demand for resources and are growing quickly by an additional 2 to 3 billion people over the next decades. The way we plan and build cities and also rural areas shapes social structures, lifestyles, and energy, water, and mobility systems. How can our urban and rural living environments be transformed in such a way that health, promoting, and sustainable lifestyles are the easier option for everyone, while providing enough space for nature? The transport sector is responsible for a substantial share of energy consumption and land sealing, as well as air pollution, noise, and physical inactivity, and therefore for many chronic diseases. How can we change living conditions in a way that climate-friendly and healthy mobility behaviors become the new norm? And how can we use the new virtual options in the best way? Today's resource-intensive production and consumption patterns are major drivers of climate change and ecosystem destruction. At the same time, competitive pressure and stress at work are harming our mental health. And our physical health is harmed by toxic substances and materials. How can economic systems and material cycles be designed in such a way that ecological sustainability and health play a central role? We are at a crossroads. Society, business, and politics must assume responsibility and initiate a comprehensive transformation that leads to healthy human life on a healthy planet. For that, we need better policies. Approaches such as One Health, EcoHealth, and Planetary Health, which link environmental protection and health protection, are not yet anchored in international or national law or used as governance concepts by policymakers. How can a planetary health approach be institutionally integrated into policies and legal areas at national, EU, and international level? Education and science are also key levers for sustainable development and healthy sustainable lifestyles. How can educational and science systems worldwide be strengthened and networked to enable responsible decisions that protect individual and planetary health? And what else do we need to ignite and speed up the great transformation? What kind of mind shifts are needed? What are the conceptual and imagination challenges that we should tackle? 10 years ago, the WBGU's influential transformation report was published. It contained this graphic. Down here is the niche level, where they are the pioneers of change. And there's sudden events in these mega trends up here that can kind of mess up the mainstream and open windows of opportunity that allow niche ideas to become the new mainstream. Such a window of opportunity may have been opened with the Fridays for Future movement, and now with the Corona crisis. More and more people are realizing that we are in a planetary emergency, and they get active together, including the health professions. In Germany, the Health for Future movement has grown exponentially over the last couple of years. COVID-19 has been a wake-up call in various ways, highlighting the importance of health systems, and also how everything is connected. A healthy and green recovery has been demanded by WHO, the Club of Rome, and many others. UNEP and the UN General Secretary Guterres have called for making peace with nature earlier this year. The report looked at all the crises and their solutions together, connecting them to human health. Ivar was one of the main authors who's with us now. Howie, Andy, Sam, and others have published books on planetary health. The Planetary Health Alliance is growing. There's in vivo planetary health. We have the Planetary Health Academy with thousands of participants in Germany and worldwide, and so on. In the transformation report from 2011, health was not really featuring. Could health, the concept of planetary health, the realization how deeply our own well-being is connected with nature, with animals, and with other humans around the world, how the realization how incredibly vulnerable we are, each one of us and as a society, but also how amazingly powerful we can be together. Could this provide the much needed boost for the transformation, give it an exponential dynamic, like a viral spread of social change? What role can health play here? What kind of vision, positive vision, do we need? What kind of understanding of cooperation and power? What role do relationships play, and trust, creativity, and inspiration? The point of our discussion paper is to get your feedback and ideas. So we ask the right questions and tackle the most important issues in our upcoming report on planetary health. I'm looking forward to the discussion. Thank you so much.
Thank you so much, Zabina, for your presentation and for your slides. I was very much reminded of Professor Rosling in the beginning. I think you got an inspiration from there. Thank you very much. Before we move on to the commentators, let's see the results of our little survey, because we have almost 200 people now participating. I hope you can see the results as well. So mainly 44% come from science. We have 40% from politics and government, then NGOs, media, education with 6%. So it's a quite diverse field, but sciences are here the majority. Thank you very much for participating, just to give us a feeling of who is with us here in the room. Thank you a lot. We will now move on to Cristina, and I look forward to hearing your comments. Cristina Romanelli is, since July 2019, the program officer on biodiversity, climate change, and health at the World Health Organization. She has lots of experience as a sustainability professional working on policy evaluation and development, multi-stakeholder engagement, and interdisciplinary research with the United Nations, specialized agencies, the private sector, and NGOs. So a lot of experience, Cristina, and I look forward to hear your comments on the WBGU paper and Sabine's presentation.
Thank you so much, Maike. It's a real pleasure to be here with you, and thank you also to WBGU colleagues for the invitation, and to Sabine for that truly terrific overview of the planetary health challenges and questions that were outlined in the discussion paper. I think it's remarkable the way you've managed to put that into just a few minutes. And I think I'm going to focus on a few key points and then maybe elaborate a little bit later, and maybe one initiative of the WHO, which Sabine, thank you for setting the scene, has absolutely mentioned. So I think that maybe to begin, you know, our success as a global community in tackling this planetary health crisis, which incidentally is also a public and global health crisis, as Sabine has just made clear, really does hinge on our collective ambition and collective political will to establish the relevant strategic partnerships at the local, national, regional, and global levels to design, finance, and implement policies, plans, and programs that are coordinated, that are also coherent and aligned across the different spheres of government. I think it's important to emphasize that real sense of urgency that Sabine has just pointed out, of moving in this direction as an essential precondition for success in achieving the aims of the various conventions at the international levels and agreements that we have collectively taken as a society, including the Sustainable Development Goals. You know, framing this as WHO, we can't help but refer back to the COVID-19 context. And without question, the ongoing COVID-19 pandemic, which has disrupted and shaken the very fabric of our social, economic, and health systems the world over, is one of many perfect examples of the systemic failure to make the connection between the natural world, our climate, and our socioeconomic and finance structures. And the questions that were raised in the position paper are essential, because now is not the time to congratulate each other, to tell us how far we've come in tackling these interrelated challenges, but really taking an introspective look at where we've largely failed, ask the hard questions, as you've just done, Sabine, and take bold, transformative action to sustain planetary health, not only to address the threats that we face in some distant future, but those we are already very much facing today. And I think that in so doing, these discussions can help bring us one step closer in expanding, aligning, and finding that common ground between climate adaptation and mitigation, healthy ecosystems, and the ecosystem services that we all depend upon for our survival, and really understanding how and why they matter to our health, which is absolutely not negotiable. As a recent report on the health argument for climate action, which was launched at WHO in the lead up to COP26, very clearly spells out. So I think that one of the key lessons that we can draw from the COVID-19 pandemic, to make the link between that and the Planetary Health paper and other crises that have preceded it, is that we absolutely have to break down the persistent silos in decision-making, and also readily acknowledge and act on the knowledge that current decisions across all sectors of society that we make today, not on how to build back better, but how to rebuild better from the post-COVID era, can either continue to lock in the damaging economic and development patterns that perpetuate ecosystem destruction and continue to drive the planetary health crisis, or we can be smart about it and draw from the lessons learned to invest in a healthier, greener, and more equitable future by strengthening our capacity for prevention, detection, and response through holistic integrated approaches such as One Health, EcoHealth, and Planetary Health, as Sabina just mentioned, in ways that allow us to address those root causes of climate change, root causes of ecosystem destruction, while identifying the opportunities that really build social and ecological resilience with equity as a central pillar. So just very briefly, as a testament to WHO's commitment toward these goals, this pandemic really has spearheaded a large number of initiatives, some of which we may refer to later, and I'll focus on one of them in a first instance, because it's especially germane to the position paper and well aligned with the principles of planetary health that were outlined in this position paper. So very early on in the pandemic, as you saw in one of Sabina's slides, WHO launched a comprehensive manifesto for a healthy, green, and just recovery from COVID-19, which essentially calls on the international community to prioritize a healthy recovery while also putting biodiversity and climate protection and equity at the center to prepare and reduce our vulnerability to possible future health emergencies. So we won't get into all of the details of what the manifesto contains, because there are 6 essential prescriptions and over 80 actionable items. What I will do is maybe provide a brief overview of the 6 key prescriptions, and then suggest to organizers and to participants that are in this webinar to then take a look at what those actionable items are, because some of them do seek to answer some of the questions that were raised. So very briefly, the 6 key prescriptions cut across a lot of the issue areas raised in the Planetary Health paper. 1, investing in essential services such as water and sanitation, strong healthcare systems, and green energy facilities. A second one, and I think I'd like to take a moment here because this is an absolutely essential one, is promoting sustainable food systems, which is very much referred to in the position paper and also in Sabina's presentation. And this one cannot possibly be overstated. Our largely dysfunctional food system is at the heart of a multitude of health risks that are introduced through the food production, consumption, and supply chain, either directly or indirectly, whether this be through land use changes, for example, deforestation, which has been at the heart of so many infectious disease risks, whether these be vector-borne such as malaria or zoonosis, or zoonoses such as Ebola, Nipah, SARS, and the pandemic we currently find ourselves in. So I think one of the clearest examples of the vulnerabilities created by our food systems to both biodiversity, health, and health outcomes really is the transformation of our agricultural system from monoculture, the intensification of crops and livestock, and the rapid narrowing of traditional genetic varieties that we use for food. Let's take just 1 second here to reflect on the fact that from over 250 1,000 known plant species, only 3 staple crops provide half of the world's calories derived from plants, and only 12 crops and 5 animal species provide 3/4 of all food produced, much of which is for livestock feed, making our crops more vulnerable to pests and disease. Decreasing the resilience of food systems, contributing to the waste of 1/3 of all food produced globally, exacerbating pressures on our soils, eroding our forests and oceans that act as natural carbon sinks, eroding traditional food cultures, and at the same time, driving up greenhouse gas emissions, 1/4 of which result from agriculture and land use change. So before, Sabine was referring to the planetary health diet. And I think that's an important point to make, because that transformation of the global food system really is very much at the heart, not only of some of the infectious diseases that we face, not only the climate crisis, not only the biodiversity crisis that we find ourselves immersed in, but also very much the growing pandemic of non-communicable diseases that we are currently facing.
Cristina, thank you very much. I'm so sorry to interrupt you, but we will have more time to dive even deeper than you already did in the discussions. And thank you for mentioning the WHO manifesto. I'm sure we will go even deeper, and I will have a ton of questions on this. But I would like to get Howard and Ivar also on board, and want to ask Howard to come to join us on the panel here. To share your thoughts on the debate paper, and I will introduce him very briefly. Dr. Frumkin is an internist or medical doctor, environmental and occupational medicine specialist and epidemiologist. He is senior vice president with the Trust for Public Land and professor emeritus of environmental and occupational health services at the University of Washington School of Public Health, where he served as dean from 2010-2016. After serving there, he led the Our Planet, Our Health initiatives at the Wellcome Trust in London. And I know that you have a lot of other hats on your hat. Maybe you can tell us more about your past experience, but I look forward now to your comment, Howard.
Sound is not on yet. Howie, you need to unmute yourself. Yay.
You would think that after a year and a half of living with COVID, I would have learned to turn off my mute function, but not quite. Well, thank you, Maike, for that very kind introduction, and greetings to all from the pre-dawn darkness in Seattle on the Pacific coast of North America. A salute to WBGU and Professor Zabina Gabrish and Maike for framing this discussion on planetary health. Let me offer congratulations on 3 points and raise 4 questions in response to the discussion paper. First, congratulations on the planetary health framing. While climate change is often and understandably the center of attention, especially following the Glasgow conference, climate change is only one of numerous interacting planetary changes, ranging from biodiversity loss to land use change to altered biogeochemical cycling. Your holistic and systems-based approach is scientifically sound and necessary, and places WBGU well ahead of many corresponding national efforts. Second, congratulations on centering human health in this discussion. Some people ground their thinking in ecosystems, arguing that humans are an invasive species, that our North Star, our guiding principle, should be the preservation of the natural world. Well, ecosystem protection is clearly important, but realistically, if we want to manage and reverse the damage humans have done, and if we want to build political support for transformative change, then humans must be at the center of our paradigm. And third, congratulations on the careful multi-sectoral analysis in the discussion paper, addressing how we eat, how we travel, how we create our habitat, how we consume goods and services. These are key drivers of our impact on the planet, So relentless focus on each of them is necessary. Now for 4 questions. First, the opening assertion in the discussion paper states that our lifestyle is making us ill and is destroying the planet. Really? The word lifestyle in English connotes behavioral choices as opposed to systemic structural determinants of people's lives. Now, the original German word may not carry just the same meaning, but still this raises the question, what is the appropriate balance between focusing on behavioral choices, how much meat I eat, what kind of car I drive, how much I fly, and focusing on structural issues, how our electricity is generated and who decides, how well the train system works, whether meat producers receive government subsidies, who controls land use decisions. Behavior change and system change are both important. What is the proper balance between them? Second, what is the role of social science in social change? The transition to a post-carbon civilization will be disruptive. Powerful industries will need to sunset or radically reinvent themselves. People in wealthy countries will need to renounce their divine right to eat as much meat as they want, to drive internal combustion cars at high speeds as far as they want, to stuff their closets full of dozens or even hundreds of articles of clothing. People will need to say farewell to beloved traditions, to some of the very ways we define our identities. In the short run, there will be losers. They will resist. Consider the shenanigans of such industries as fossil fuels, meat, petrochemicals, and plastics. Consider the rise of the Gilets jaunes in France in 2018, triggered in part by relatively incremental increases in petrol and diesel taxes under President Macron. Achieving planetary health is not just a technical challenge. It is a challenge of culture change, meaning political change, and as several people have said in the chat, fundamental economic system change. Are we listening enough to behavioral scientists, political scientists, ecological economists, anthropologists, and others as we work to understand and overcome barriers to change? Third, how do we communicate a transition to planetary health? This cannot be a story of deprivation and sacrifice. It must be a story of opportunity, of improved lives, of health, well-being, happiness. We have ample evidence to support that story, as Zabina made reference to in talking about co-benefits. We need to tell the story well, to inspire solidarity instead of tribalism, cooperation instead of resistance, hope instead of despair. What are the most effective evidence-based communication strategies? Fourth, and finally, what about international policy? We know that nations of the global south are highly vulnerable to environmental change, much of which they did little to trigger. We know that health status in many of these countries is poor and healthcare infrastructure is fragile. We know that these nations need generous assistance from wealthy nations, assistance they are not receiving. We also know that pressures for migration from the global south, due in part to environmental disruption, are large and growing. And we know that even the limited migration we've seen to date has fomented hostility and nationalism in Europe and North America. How should foreign policy recognize and incorporate the planetary health challenge? Well, thanks very much for the chance to offer these comments. I very much look forward to our discussion.
Thank you so much, Howard, for your questions and thoughts for the debate paper, and I'm sure the authors will use that and incorporate it in the further thinking. Thank you so much. We will talk about this even more in the discussion, but now we come to the last comments for now from Ivar Andreas Baste. He is a senior advisor at the Norwegian Environmental Agency, and he led the report Making Peace with Nature by UNEP, as Sabine has said. And he is the co-author for the Future of Geo Process Steering Committee. He has also served as a member of the IPBES Bureau at UNEP. Ivar, very great to have you. I look forward to your comments before we start to discuss further ideas.
Thank you very much, Maike, and good morning and good afternoon, evening, everyone. It was also very excellent presentation by Sabine. I think that really captured also very much the essence of the findings that we try to sort of home in on in the Making Peace with Nature report, which, by the way, was an initiative by the UN Environment Programme to bring together some 50 experts to analyze and synthesize the findings of the latest some 25 global assessments, environmental assessments of the world. I think it makes a lot of sense actually to look at the environmental challenges from a health perspective and a health lens, and we also try to do that in the Making Peace with Nature report. Just the fact that 1/4 of the global disease burden is related to environmental risks, be it pollution, air pollution, water pollution, chemicals, the upcoming now effects of the global warming, which we are seeing taking place, its impact on people and on food production and on biodiversity, the loss of biodiversity, which are impacting people. Just the fact that I think we sort of identified 4 billion people primarily depend on natural substances for them in their medication, and so loss of biodiversity is basically threatening that very contribution by nature to human well-being. Now, the other dimension of that is that if you look at, and I very much also agree with Howard here, that the focus on and the motivation for actually working on combating and halting environmental decline is really the need for us to promote and protect human well-being. And if we look at sort of the constituents of human well-being, and for instance take the approach of Nobel laureate Amartya Sen, there are basically 4 sort of key constituencies, one of them being health, the other one is material needs, the third one is social relation, and the fourth one is security. So it is actually a main motivation for the environmental governance of the planet. When we and obviously sort of planetary health also goes beyond that and looks at sort of the fact that we are now, unfortunately, the environmental governance is approaching its 50th year anniversary next year. Ever since the Stockholm Conference in 1972, the environmental challenges have been growing in severity and intensity. And we are no doubt now facing this triple environmental emergency that Sabine also pointed very nicely to. It is basically quite dramatic because it is we are both destroying and surpassing Earth's finite capacity to support human well-being. It affects us all, but I think as Sabine and Howard and Cristina already pointed out, it obviously affects poor and vulnerable the most, and it looms even larger over today's young and the future generations. The interesting thing, I think, is also that through the environmental agreements, we have sort of identified what we need to do, but virtually all, perhaps with a few exceptions of our environmental goals and targets, we doesn't seem able to meet them, and we're facing many of the same challenges also, obviously, with trying to meet the Sustainable Development Goals. So I very much agree with those who spoke before me that we are facing a systemic challenge here. We basically need to sort of redeploy human knowledge, ingenuity, technology, cooperation towards transformation of both societies and economies. And that is really a tall order, no doubt about it, because we have to do that while sort of maintaining the hard-won development gains, whilst also making sure that we that we are honoring the rightful aspirations of poorer nations and poor people to enjoy better living standards. One of the sort of key conclusions in the Making Peace with Nature report, which kind of would be a sort of fifth, well, maybe a sixth element. I think you partially captured it, Sabine, but that it is actually our sort of key conclusion was really that, well, first of all, we need to address the environmental emergencies together because they're so interconnected. I think you pointed to a number of them, also the win-win situations that addressing them together can achieve. But because of the sort of systemic nature of the challenge, we need to start with the financial and economic system, and transformed financial and economic system can really play a major role in leading and powering the shift to sustainability. Then obviously key systems are the food system that we talked about. It's the energy systems and virtually all our different systems. And as Cristina pointed to, that really requires a lot of cooperation across the aisles, the current silos. We are living in a polycentric society where a lot of different entities are interacting, and we need to align actions by so many different actors in society. And that, I think, as was pointed out by Howard, really also means changing the worldviews, changing values, aligning actions, doing everything, looking at everything basically in the way society is configured. So it's a tall order, but the conclusion in the Making Peace with Nature report was optimistic. We believe that it is possible to do it, and we definitely have no choice. And it's in many ways also perhaps a quite cool challenge, but we then need to get across a lot of hurdles, and vested interest being one of them. But we have very little time, a decade or so. So with those few words, I'll thank you very much for the opportunity to join you here today, and look forward to the ensuing discussions. Thank you.
Thank you very much, Ivar. I see that there are already also coming questions in on the economic and financial system that needs to change, and you just talked about this also in your report. So maybe we can dive a little bit deeper there soon. But I would start with the first round of questions to each of you, but would like, before we do that, ask maybe Sabine if you have some first reflection, first answers to the commentators and to the comments of the three other panelists. Sabine, you would like to share with us?
Maybe to answer Howie's question on the lifestyle, which like I'm always a nerd when it comes to translation, so that confirms it's important. And in German it said Lebensweise, which I think is broader than Lebensstil, because but it's of maybe different people have different connotations, but definitely what we wanted is not just individual behavior that is driving it, but rather the conditions around it. So in German, there's these terms Verhalten und Verhältnisse. So we're very much thinking in the systems way, and like, how do we make it, like the questions were framed like that, as you notice. How do we make it easy for people? How do we create systems and conditions that favor the environmentally friendly and healthy behavior instead of favoring the opposite, as we currently do with our infrastructure, our subsidy systems, and so on. And at the same time, of course, individual behavior is also important, because that can also drive change as a collective action and so on. But it's not enough, of course. Yeah. I'll stop here so we can get moving. I'd like to have the discussion with all the others.
Thank you, Sabine. So maybe that is just something that got lost in translation, lifestyle, and rather referring to the more structural dimension of it. Cristina, I would like to come back to you. I read that you are part of a new WHO IUCN expert working group on biodiversity, climate, One Health, and nature-based solutions. Maybe you can share with us some of your findings or what you have discussed so far, and what are also maybe the major health co-benefits of sustainable ecosystem management and restoration.
Thank you so much. Well, that is a multi-pronged question, Maike. I'm going to be as brief as I possibly can.
I'm sure you can answer it.
And just point out a few. So yes, thank you very much for pointing out the new expert working group on biodiversity, climate, One Health, and nature-based solutions. It is a mouthful, but then again, it is a multitude of concurrent challenges that we face. And the reason we selected to convene those is to speak to one of the points that Ivan had raised, and very much in line with the planetary health approach, is that we need to address the concurrent environmental crises that we face jointly. So often we're talking about, going back to the silos I was referring to earlier, often we're talking about either climate and health or biodiversity and health, or, in very siloed ways, rather than looking at the full range of environmental and social determinants of health. And that's exactly what the expert working group seeks to do. And so, I mean, I don't want to preempt all of the recommendations of the expert working group, which is co-chaired with IUCN. So very much a novel partnership, but also brings in several UN agencies, academia, and voices that have long been excluded from this narrative, including voices from Indigenous peoples and local communities. So I think that it is worth noting that, without wanting to preempt all of the recommendations that come out of that, suffice it to say that we are currently working on how to bring those things, those elements together, for instance, through nature-based solutions or ecosystem-based approaches, whichever term you prefer, all in the perspective of One Health, eco-health, and planetary health. So a lot of terminology to get through moving forward. And essentially, if we get to the heart of it, what we really need is immediate action, concerted action that is guided by a common narrative, because right now we've got narratives that are very sectorally based all over the place. So finding that common ground that I was referring to earlier, and guided by a bold long-term vision to jointly achieve essentially planetary health gains. So how can we do that? But, just to give a few just to give a bit of a feel of some of the elements that have been raised, is by focusing on the environmental and social determinants of health, by shifting, importantly, our focus from response to prevention, to maximize the co-benefits that you were referring to earlier, and bringing in non-traditional partners to engage, and making health outcomes also a central part of that narrative, because while it's a central part of the narrative in, for instance, One Health approaches, it's very much neglected when we're looking at how we conclude global agreements on climate change or the post-2020 global biodiversity framework, ensuring that health really is embedded in those, and linking across the various agendas. How we, Ivan, Sabine, of course, have all spoken to this, transcending our typically siloed approach to global challenges. We had key opportunities in Glasgow to renew and strengthen the commitments that we'd made in Paris, but we also have concurrent challenges and opportunities, including the post-2020 global biodiversity framework, which I want to re-emphasize because that one is forthcoming. And within that, there is an opportunity to also adopt a global plan of action on biodiversity and health. So one of the mandates of the expert working group will be to develop an operational framework around these planetary health sort of principles. So there are an enormous number of entry points, but this time I want to leave to others to fill in some of the gaps, and we can continue the discussion.
Thank you. Yeah, you have to leave a little bit also for Ivar and Howard. Howard, I would like to come to you and ask you in your comment recently published COVID-19, the Built Environment and Health, you named potential long-term implications of the COVID-19 pandemic for the built environment. Are there any findings that you can also apply to the link between health and environment in more general terms? How will COVID-19 change how we build environment?
Thanks, Maike. Yeah, COVID-19 is such a tragic but interesting and potentially opportune moment. Just within the built environment, the response to COVID-19, I think, has given us some glimpses of a more planetary health-oriented world. For example, the increased use of parks and green space around the world emphasizes to us that people greatly value access to parks and green space. The reconfiguration of urban streets away from automobiles toward walking, cycling, commerce, restaurants, even classrooms indicates that there is a different way to think about urban space than simply dedicating much or all of it to automobiles. The transition to teleworking, to telehealth, to teleconferences, as we're doing now, reflects the ability to continue to function with much reduced travel demand, which translates into a reduced carbon footprint. So these are lifestyle and built environment changes that may last after the pandemic and that may be very positive in planetary health terms. There are larger issues, of course. So we don't know the full story of the COVID-19 pandemic origins yet, maybe never will, but it is clear that pandemics like this arise from disrupted relationships between ecosystems and humans, disrupted ecosystems in general. And to echo Cristina's comments, the dysfunctional food system that brings animals into contact with people in settings like wet markets can help drive pandemics. So we need to rethink our relationship with the natural ecosystems for this and many other reasons as well. And finally, there are some big issues that are raised by the pandemic that are very germane to planetary health. The huge impacts of poverty and social inequality, highlighting the disproportionate suffering of the underprivileged. The role of loneliness, the craving for human company that has been one of the prime lessons of the pandemic, which highlights the planetary health opportunity to build societies and environments more around human interaction and human needs than around consumption. It's the company of other people that we missed much more than we missed that extra pair of pants or that extra trip to the tropics. The need for appreciation of science and the potential danger of disinformation has been a constant theme through the pandemic, and that appreciation for science will also help drive the planetary health transformation. And finally, what we're calling in the US, and I think you're calling in Europe as well, the Great Resignation, the fact that so many people, especially young people, are declining to return to their same old jobs now in the economic aftermath of the pandemic, resetting the relationship between work and life, and potentially underlining a deeply felt need to create lives with more meaning and more balance. These two are things that are at the heart of the planetary health transformation. So this Great Resignation, while it cripples economic activity in some ways, is an important data point and helps us reconceptualize what planetary health and what good lives are all about.
Thank you very much, Howard. Very interesting and a lot of food for thought. Thank you so much. Ivar, I would like to pick up a question from the Q&A, also with a question I have prepared. The economic, financial, and productive systems can and should be transformed to lead and power the shift to sustainability. Society needs to include natural capital in decision-making, eliminate environmentally harmful subsidies, and invest in the transition to a sustainable future. The question in the Q&A is, how can we transform our economy, especially trying to achieve less inequality? And maybe you can also look and explore a little bit the role of multilateralism in this instance.
Well, yeah, I wish I was an economist so I could answer that adequately. No, I think actually also the way you phrased it, I think what we have identified in the report, which actually did include economists, was I think basically sort of 3-4 main points. So the first is sort of that currently our sort of economic system is really based on using one sort of key parameter, which is gross domestic product. So we're looking at the sort of basically only financial flows. So if we look sort of 50 years back, so that we become twice as many people on the planet, but our economy has grown by 5, and really to a large extent fueled by a tripling of resource extraction, natural resources, food, and also consumption of energy. So if we were to sort of take another sort of approach where we looked at sort of a more sort of inclusive wealth approach, looking at sort of including natural capital, social capital, human capital, one would actually see that the for many countries the economic the growth in wealth is not sort of 5 times, but is more like sort of 2 times. So if one sort of takes account of the lack of or the degradation of capital, the picture is quite different. So I think that's the first point, and one need to sort of include natural capital together with social and human capital in decision making, and there are a lot of interesting multilateral initiatives going on trying to do exactly that. I think the other thing is obviously then to move towards much more of a circular economy, which promotes sustainable consumption and production patterns, and there are also a lot of interesting initiatives there, I think, internationally and multilaterally in multilateral sphere, which also can be applied nationally. The third element is really to have a closer look at subsidies, and I think it was the International Monetary Fund who sort of looked at the what are the amount of money that actually goes towards subsidies in fossil fuels, agriculture, fisheries, and transports. And if you look at both sort of the investments into the subsidies themselves and the costs that they entail on the environment and human health, they amount to a sort of staggering number of some $5 trillion per year. And of course, if you could sort of redirect those investments and also somehow capture the costs by taxing, then there is quite a lot of money there that could be redirected. And that is actually the last point. That is actually redirecting finances and financing actually the shift towards sustainability.
Thank you so much, Ivar. I see that there are more questions going in this direction, but I'm sure we come to this. But I would like to now invite other participants here in the Zoom meeting to come in, and I see a couple of hands already. And please also keep sharing resources in the chat box. That's very helpful. Thank you for that. And I would like to start with Karen Pitte, please.
Yeah, thank you very much. And high appreciation to everybody for the discussion so far. It has been so interesting. I should say I'm also part of the WBGU, of the WBGU. And so this is for me, of course, extremely helpful. I dare not admit it, I am an economist, so I should probably have good answers. Of course, I mean, there's a lot to it, and perhaps just 2 additional points, because the ones you made were already, I think, extremely helpful. The one thing I always think of is that providing more equality in societies is not only a matter of redistributing money, but is especially also a matter of providing opportunities. Access to education, access to infrastructure, access to health systems, and that's still very much unequal. Still, even like in our society, where we sometimes pride ourselves that we have a decent, let's put it like that, not perfect by far, level of redistribution, we still have staggering numbers, for example, for access to universities, or actually which students, which high school students go to university, and a colleague of mine will flame me alive if that's the wrong number, but I think it's still more than 90% of the university students that come from a basically university educated background. So we have to change a lot in that as well to get a more equal society, apart from financing. The second part with the trillions that you mentioned, the subsidies, I mean, that's always the two things. It's not only like inducing more sustainable development by abandoning fossil subsidies, but also that actually countries get money into their pockets. I mean, now they have to pay, and basically in those trillions that are usually calculated, there's also the non-existent taxes on CO2, for example. It's not all explicit subsidies. It's sometimes just the lack of taxation. And so you can actually raise a lot of money and do a lot of good with that. But I had a question. That's why I actually raised my hand. I was just wondering about COVID, because I mean, we do see all this raise in consciousness with people regarding health, regarding preventive measures, regarding finances that go into that. Also regarding the value of interhuman interaction, of living in an attacked society. I'm just sometimes afraid how long this is going to last, because we have seen many times in the past that actually after a catastrophe, after a health scare, people vowed to, for example, never eat meat again, or at least not what's it? Yeah, the one that causes the brain, which is it? Beef. I'm sorry. Sometimes it's just, and then in the end, nobody really, many people did not adhere to this, what they said in the beginning. So has there been any discussion in the health community how to make these positive effects that we observe at the moment, and this willingness to put more thought into all of this and to pay more for having certain like resilience increasing measures? How can we keep that? How can we keep that alive? A question to everybody, I guess.
Thank you so much, Karen. I would say we take two more and then go back to the panel, and I see Nicole de Paula's hand raised.
Hello, everyone. Thank you, Maike. It's so good to see so many colleagues and friends. We've been doing this for many years. I see Cristina smiling, and so Ivar, I think we met, maybe you don't even remember, but decades ago. So we're all here evolving. But I'm speaking today from Rome, when I had just joined the United Nations Food and Agriculture Organization. So I'm very glad that we're talking a lot about food systems, because of course this will play a very important role. So I'm looking forward to exploring new partnerships on this. We have a new office on dedicated to the SDGs. So I think that's a very good signal, showing that, of course, this narrative of breaking the silos and creating more coherence instead of the sectorals is very important. But I just published this book called Breaking the Silos for Planetary Health. And I think this motivation came from these meetings, when we are always, you know, it's kind of almost an easy solution to say we need to break the silos. So the title was good, but so far I don't think we're so clear what exactly it means and how do we do it. So because the silos, I don't think it will disappear, right? So perhaps the best way, even though I also call it breaking the silos, we really need to unite the silos. So the paradox is we still need some silos, because, you know, it's the sectoral approach. How do we eat an elephant, right? We need to take part by part. So I think the collaboration and the partnership is very important. And I think we're also mentioning, and on that, I would just, I have so many comments here, but one, I did and please correct me if I was wrong, but doing a quick search on the document, for example, there are a few words that I would like to see, or perhaps I'm still missing. And I still didn't see a lot of the word, for example, inclusive or gender or equity, and even the word digital. And I think when we talk about, and we're all in this together, and the question is, are we deciding things together? And perhaps I think in terms of recommendations, this diversification, and I think Cristina, you mentioned the diversification of diets, it's important, but it's important to have this diversification and decision making. And when you have the same groups, or same, of course, women excluded from the decision making tables around the world, and when we talk about land, when women don't have access to land, so it's not only about land use change, but so many of groups who are potential solutions, not only the victims, when we talk about indigenous knowledge, gender equality. And I'm surprised after 1 hour we are in this together, we have the best brains here and we still didn't mention these words. So we'd just like to highlight that how do we change mindsets? How do we change our own mindsets to recognize this is a very important point, that we need equality in our society. So if we talk about root causes, I would like to see more of this conversation about, as we talk about financial systems, so that's trying to see the gaps here on the financial sector is very important. We don't seem to have a strategy to engage the financial sector in a way. What's the narrative that we have been using for 20 years? Oh, if we finish the resources, you're going to be out of business. So how do we go beyond the profit narrative for business? How do we create a very more beneficial, productive relationship with the private sector? And I think the agri-food business will be a very good example to explore that. So some of the comments that I would like to highlight and really encourage the authors in this report to bring these words and the digitalization process as well. We're all in bubbles now. So if we don't take the process and who has access or bias, I don't think we're gonna get out of this planetary emergency in a more on the equal foot. Thank you so much.
Thank you so much, Nicole. I would like to ask all the following participants to keep it very short because I would like to hear more and diverse voices as possible. So maybe we can come up with short comments and questions. And maybe we take one more and then I take it back to the panel. Remco, I see your hand raised. Remco?
Okay. Yeah, do you hear me? I don't know if you can see me.
I hear you, yes. I can't see you, but I hear you.
Let me try if you can see me as well. I don't know why I can't be seen, but you hear me.
Yes.
Remco, a health policy researcher. Thanks for this very insightful debate. Just then two short things in relation to what has been presented in the beginning from Sabine. We have to differentiate and unpack a little bit if we talk about who is we. We have to do things, because we is something quite different here in Western Europe than it would be in other parts of the world. And the we in an, let's say in a poor or marginalized part of town is quite different from a better, well-off, educated part of society. So we need to, I think, unpack a little bit, and there also in relation to what is considered healthy and what is good health. That requires much differentiation. And we should be careful to impose a kind of a Western approach to how to do this and what it means to, let's say, to live in good health and how to live in relation with nation and the environments. So I think it's a plea for differentiation when we implement the planetary health principles. Now, there was already a reference by Howard also to social inequities and the different interests in policy drivers that really influence how we take this narrative forward. And I think there we need to understand that I didn't hear the word justice yet. If we talk about health justice, climate justice, and it's about social justice, then we need to find a narrative to bring people along in this message, and to go there, I think we need to tackle a little bit also in the economic systems, and there were references to the limits to growth, the Club of Rome, but they were created in a time when the United Nations was also talking about a new international economic order, and that economic order that the UN then advocated for is quite radically different from the rather capitalist, economic, globalized order that we have now. So if we want to take this limits to growth thinking forward and the ideas embodied already in the Club of Rome thinking, then we need to take that economic model also serious, which would mean interfering somehow together as a community with our governments in the way how our globalized economies are organized at the moment. Financialization of land investments, trade rules, the debt environment, etc. So we can have health argument for that, but if we really want to make the transformative change, then we need to engage in this debate as well. Thank you.
Thank you so much, Remco. I'm asking the panel, Howard, would you like to comment on what we have heard from the questions raised?
Thank you, Maike. Fantastic interventions by the speakers. So I'll just respond very briefly on Karen's comment regarding COVID. Yes, absolutely. I think maybe one of the lessons from this discussion for the conversation going forward is let's identify the best outcomes of the pandemic. The pandemic, by the way, may be with us indefinitely. This may not be something that just ends and we forget the lessons quickly. It may be that we are coexisting with this particular family of viruses for the rest of our lives, which ironically could help with reinforcing some of the lessons that Karen pointed out. But let's very much call this out and make it a thing and consider how to identify the best outcomes and preserve them. As for Nicole's comment on the role of the financial sector, I agree. I think we haven't talked about this, but a lot of the activists around the world have focused on divesting from companies that produce fossil fuels, pollutants, and other dangerous products. There is also now increasing activist pressure on investment houses and financial firms themselves to get them to stop making investments in these dangerous processes. And there is even activist pressure on the public relations firms that are supporting these companies. So it makes good sense for us to be supporting those activist efforts. In fact, in general, the activism of young people in recent years has been one of the greatest signs of progress and causes for hope, and we should be supporting that. And finally, on Remco's comments on justice, on economic transformation, yes.
Just yes. Thank you so much,
yes.
Howard.
Yes, yes.
Ivar, would you also like to come in, and maybe I can also raise another question from the Q&A that fits a little bit your past intervention. There's a question on how should we define economic success, not just based on finance, but benefits to health, society, and environment. Maybe you want to reflect on this as well.
Well, thanks a lot, Maike, and thanks for the questions and all the interventions. I think it's really great. I guess one of there's so many things in a way that needs to balance if we are going to succeed in the transition that sort of takes all dimensions of the Sustainable Development Goals fully into account, and obviously it needs to be just and informed and transparent. We need a different way of sort of valuing, I think, human well-being, and that our worldviews need to change. And one thing that has sort of struck me, maybe it's sort of a quick observation, is that in the environmental governance, we sort of put a lot of emphasis on trying to create a vibrant interface between science and policy as a basis for diffusing potential conflicts between different nations. Perhaps it's time to also take these processes to the national level and start thinking out sort of how can we bridge science and policy at the national level, trying to sort of make sure that we develop the knowledge base for the transition to sustainability and all the trade-offs that we need to do, so that we share, we develop a shared knowledge base across the different silos. Because as Nicole said, we obviously there's a lot of competence and that we need to use in that transition, but we also need them to sort of sing from the same hymn sheet. We need this to be a sort of orchestrated approach where we also open up for obviously for improvisation in order to adapt to local circumstances. So perhaps something also to think about, sort of how do we make sure that we have a solid knowledge foundation to make sure that we have evidence-based decision making in the transition that sort of really safeguards all the different dimensions of sustainability.
Thank you, Ivar. The knowledge challenge is of course there, but I think the implementation challenge is even bigger. Before I come back to Cristina and Sabine, I would like to get more comments, but very, very short because we are running out of time. Maybe Margaret, Hannah, you would like to start as short as possible, please.
Thank you very much. I'm pretty much in awe of what I'm hearing from the panel and all the responses they've been making. And I will keep my response very short.
Margaret, can I stop you for a second? I'm sorry.
Yes.
I can't really hear you. There's a little bit of clicking or whatever in your
I'm so
audio.
sorry. Go to somebody else then.
I'm very sorry. Maybe you can type your question in. Sorry. We move to Andrew, please.
Hi, everybody. Thank you. Seems lots of guilty secrets. I'm an economist by background too. I was very, one comment and then one question. The one comment was I was very pleased that Howard and Ivar and others, and quite a lot of the people in the chat room were pushing off in the direction of thinking about this big juggernaut, this economic structural thing, which I don't think is in the WBGU report strongly enough. And, you know, that's got to be something that's got to be teased out. My question is about the COP and the next COP. We've had one COP, we've got another one coming. What are the low-hanging fruit? What are the priorities? What areas could we push for and get onto the agenda in a practical sense to have a bit more influence on that meeting? I'm thinking planetary health indicators, perhaps some thoughts on that. There's been a lot of stuff about food and food systems, hardly on COP26 at all, even though we know it's a major contributor in many, 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 many dimensions. Is that a low-hanging piece of fruit? Are there others? Coal's being dealt with, energy systems being dealt with to some degree. And I suppose the COP26 recognised the importance of biodiversity and health, biodiversity and climate change a bit more than in the past. Could we build on that? Thank you.
Thank you so much. We also had a question in the Q&A regarding health-related indicators that do not play a role in COP. So maybe that's something to think more about, and maybe the Lancet Countdown can help there. Bernhard Goodwin, would you like to come in with a short intervention?
Actually, Kim is first, I think, but
is okay. I will.
Go first.
Kim is the next one. Please go ahead, Bernhard.
Okay. So I just was wondering whether we are thinking too much on only the micro and the macro perspective, but we should also look at the meso perspective of institutions where we can have action. At the moment, we are always thinking, yeah, systems change is too big to really do. And if we look at behavioral change, doesn't make a lot of difference. But there is the meso perspective, and I think that could be a place where people can act and have self-efficacy and feel that they make a difference.
Thank you so much. Kim, would you like to come in?
Yeah, just very briefly. Sabine and others have mentioned the importance of our relationship and mending our relationship with nature, and also how it might be important to understand that humans are a part of nature and also depend on intact ecosystems, etc. So this on the one hand, and then Howie also commented on people having to be center and congratulated the WBGU on that. And it's understandable because if humans created this mess, it's humans who have to clean it up, so to say, if I understood you correctly. If not, please comment on that, Howie, as well. And not wanting to create a false dichotomy here, but I'm just curious about what Sabina mentioning, so how we can ensure that putting people at center is helpful and does not contribute to using the same mindset to basically solve problems that have created it. So thank you.
Thank you so much, Kim. Maybe Zabina, you can answer this in a second. We are unfortunately running out of time, and I see we should meet again tomorrow and the day after, I think, because we have so much food for thoughts here. So I would like, and I have to ask the panelists for the last statements, and you can of course go back to what we just heard from the other participants, but also would like you to be very concrete and maybe give some recommendations towards the new coalition government here in Germany. What do you think for the next 4 years Germany could do or should do in planetary health policy? What's needed? Because I think that's very interesting for the authors of the next WBGU report, and maybe you can help there a little bit. But feel free also to comment on the others as short as possible. And Cristina, I would like to start with you, please.
Okay, great. Thank you so much. I think that regardless of the sector that we're working in or representing here, we really need to think about where we failed our economic system, our political system, our natural systems, our health systems to generate this sort of perfect storm of socioeconomic and environmental breakdown that we're facing here today. And the discussion that we've had here today, the beginning of this discussion needs to continue because it really does provide that opportunity to rebuild better. But how do we do that? We have to be bold and purposeful in our actions to catalyze that transformational change. And catalyzing that change calls for, first and foremost, a renewed focus on prevention of health risks. I want to reemphasize that, bearing in mind that 7% of the budget is actually focused on response rather than prevention, which allows us to really get to those root causes of ecosystem breakdown, engaging in co-creation, collaboration, coherence, and innovation. Innovation by catalyzing investments in new, greener, and cleaner technologies, for instance, through a decarbonization of the economy. Innovation in the creation and strengthening of institutions that currently still work in those silos that we were referring to. Innovations by moving to beyond the tendency to compartmentalize the protection of biodiversity and ecosystems from that of climate change, and making those separate from our goal of safeguarding human health and well-being. We've already seen what the consequences of that are. Innovation in how we develop safeguards, in transforming traditional ways of thinking and in doing business, and in ways that actually catalyze that behavioral change that came up in this discussion, in creating new and innovative ways of financing, whether those be through blended finance, by harnessing the potential of public-private partnerships, microfinance, green bonds, et cetera, innovation in the design, monitoring, and implementation of nature-based solution projects. We haven't had a chance to discuss those, but those are an essential way forward that we'd also need to think about moving forward in this paper. And by thinking critically about how and where we failed in our investments to uphold the social and economic and environmental structures that have led to the planetary health crisis that we are facing today.
Thank you so much, Cristina. In the new coalition treaty, the German government is planning to have a new national prevention plan, national prevention program. So I think we are going in this direction, but I think the planetary health community have to advocate a lot that this is also in a sense of planetary health. Howard, your recommendations to the German government, maybe in less than a minute, I'm sorry.
Maike, thank you. You're challenging my natural urge to be humble and not give advice to other countries when I come from a country that has its own problems. But just building on the last comments, two pieces of advice. One is explore the use of different indicators than the GDP, gross national happiness, genuine progress indicator, and so on. If those were implemented at scale, Germany would be the first of the major wealthy countries to shift indicators to ones that are more relevant and meaningful. And second, invest in communications research and communication strategies. We've all talked about the need for more effective narratives, but we don't know what works in helping to build the solidarity, build the more constructive, positive, optimistic planetary health narratives. So let's learn in each cultural context across all of Germany, what are the best ways to communicate this to bring the public along? Good measurements, good communication. Thank you very much for the chance to be here today.
Thank you so much, Howard. And also thank you so much for being so brief. Ivar, over to you, your recommendations to the German government.
Thank you very much, Maike. I think I would be quite building on what Howard said. And I think if Germany, as one of the major economies of the world, actually could almost sort of ask its finance ministry to sort of try to figure out sort of how the economic and financial system can lead and power the transformation to sustainability, I think that would be intriguing to mobilize that know-how and the insights that the German Finance Ministry and all other resources that are drawn together with all the different ministries, obviously, and the systems, and then perhaps we can move from transforming nature, which we're currently doing, to transforming our relationship with nature, which was what the UN Secretary General called for, and really encouraged us to stop the senseless and suicidal war on nature.
Thank you so much, Ivar. Over to you, Zabina, and maybe you can help me close this event in less than 2 minutes. Zabina, your reflection, was this helpful for you and for your co-authors at WBGU?
Yes, thank you so much, everybody. It's like amazing what spark of ideas happened here. And it actually proves the point that humans are by nature creative and cooperative. and this is basically what we need to build on. I think it needs both. It needs like a mass movement of people trying to do things in a different way, also trying to change their own mindsets, Kim, like you said, that this relationship change, but also we need to push our governments to create the conditions that favor that instead of favoring the opposite. And your concrete question on the German government, we're kind of come really quite along with global health and health system strengthening in the world, and now adding the climate component. So it's really the next step, sort of, where Germany could be a leader is adopt some kind of planetary health concept. And it's coming anyway. We have to look at things that way. We have to look systemic, so that they could be a leader on that, with a structural perspective, a systemic perspective. And that's not just environmental politics. Now that our climate policy is distributed in 3 ministries, that's maybe helpful. Then we have foreign policy, economics, environment, but also development policies. And each of them kind of need to think in this way and then connect across these ministries, that people work hand in hand to favor the transformation, both at the highest level, but also at the medium and the community levels. And yeah, and I'm looking forward to discussing this further and moving it along with all of you and all the people in the audience who've contributed so nicely on the chat and on the F&Q questions. We will also have a German launch, by the way, on 2nd of February. And I think, Maike, with the think tank, we can organize many other discussions like that. So for those who are keen, there shouldn't be a shortage of opportunity to interact. Thank you.
Exactly. Thank you so much, Zabina. Also, a big thank you to the panelists, to the extended panel here in the Zoom call, and also to the WBGU Secretariat, especially to Benno for organizing everything in the background that we don't see here. Thank you so much. There is a WBGU newsletter you can sign on to on the website when you don't want to miss out any other events talking about the upcoming report on planetary health. And as Sabine just said, we will organize another German launch of the debate paper on the 2nd of February. And it's just a good idea to pick up the conversation in between or after that. And I will think about this, how we can do that in the think tank. Thank you for bringing that up, Sabine. So with 3 minutes over the time, I hope that's okay for you. I say,
let's give Karen a final word as the WBGU.
Of course, Karen.
Sabine thought it was a good idea if I, as a co-chair, actually say something. But I mean, there's so much already said. I think the only thing that's really missing is, on the one hand, to thank Zabine as well, because she did a fantastic job in presenting our paper and also in discussing, of course, thanking everybody else discussing on the panel, in this room, in the audience, providing so much in the chat. That's great. And the only thing that's remaining after such a inspiring session is really to just wish you all a very healthy and a very joyful holiday season. Thank you very much.
Thank you. Good afternoon, good morning, wherever you are, and Merry Christmas.